Hey everyone, if we're just now meeting for the very first time, hello, my name is Stacy. I'm a paramedic instructor, and today I wanted to talk about a medication that we use quite frequently out in the EMS field and is for the most part pretty well known amongst the general public, and it's called aspirin, aka acetylsalicylic acid. Say that 3 times fast. First things first, aspirin, which is also marketed under the brand name of Bayer, is a non-steroidal anti-inflammatory drug, so it falls under the drug class of NSAIDs. But why would we use that out in the emergency medical services field? As EMS clinicians, we administer aspirin to patients who have a complaint of chest pain, but not any kind of chest pain. So if we have a patient that just got into a car accident and is complaining of chest pain because they hit their chest on the steering wheel, not a candidate for aspirin. But if we have a patient that is complaining of new onset of chest pain following physical activity, or maybe perhaps they're just sitting in front of their TV and all of a sudden they have chest pain and we suspect it's from a cardiac origin, whether we know that they're having a heart attack or not, we can administer aspirin. And I think oftentimes we get confused because the general public knows aspirin as a pain reliever, as an analgesic. But in EMS, we don't use it for its analgesic properties. We use it because it prevents platelets from clumping together, right? It inhibits platelet aggregation. So it doesn't bust up current clots, but it can help prevent future clot formation. And as always, make sure you're abiding by your local protocol and staying within your scope of practice. But with aspirin, the dose is going to be anywhere between 81 milligrams to 324 milligrams. Now, some protocols will say 325 milligrams. I'm assuming because they're talking about the one coated tablet that's a maximum dose. But in most EMS ambulance settings, you're going to see the chewable aspirin because a lot of times the ambulance doesn't have water for you to take a pill. So they'll just give you 4 chewable 81 milligram tablets, which adds up to 324 milligrams. And this is contraindicated in pediatrics, which we'll get a little bit more to in a minute. As for other contraindications, bleeding is the main one you want to be careful with. Active bleeding, whether it be external where you're able to see it or internal where you just have a suspicion of it, GI bleeds, peptic ulcer disease, bleeding disorders, any of those you want to be very, very careful. And aspirin intolerant asthma. Yes, 100% it's a thing. And if a patient has a history of allergies to ibuprofen or Toradol or other NSAIDs, then aspirin should probably be taken off the list of things to administer to your patient. As for adverse reactions to aspirin, very rare that you're going to encounter anything like this in our presence, especially in the pre-hospital setting. But nausea and vomiting, a GI bleed, stomach pain, all of those could be some yucky reactions to aspirin. And keep in mind with aspirin, for drug interaction purposes, that aspirin will potentiate any other anticoagulant, any NSAID, any clot buster. So if a patient's already on a blood thinner, just be aware that aspirin can potentiate those effects. A couple of side notes about aspirin. First of all, we talked about the fact that we don't give it to the pediatric population. I just wanted to expand on that just a little bit. The reason as to why we don't give aspirin to the pediatric population is there is a condition called Reye's syndrome, and the pediatric population is just a little bit more prone to it, and it can cause swelling of the brain, go on to cause brain damage, liver damage, and even death in some cases. So aspirin is not meant for children at all, and oftentimes you'll hear aspirin called baby aspirin. And when they say baby aspirin, they're just referring to the fact that it's low dose, that it's 81 milligram. I wish that they would take that out and not call aspirin baby aspirin anymore, just to clear up that confusion. But we are never to administer aspirin to babies or children. And in these videos, I like to include what the antidote of the medication is. And unfortunately with aspirin, it's not like Narcan for narcotics. There isn't a clear-cut antidote, but oftentimes various EMS protocols will call for the administration of sodium bicarbonate or calcium for aspirin overdoses. So that's why it's so important and paramount for you to know what your local protocol is and what is all included in your scope of practice.